A subscriber shared some serious complications in their dog from this drug, Apoquel. Now the most popular drug for allergies in our dogs. Could this be doing more harm than good? Find out in this video.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
Hello, welcome back to my channel, and if you're new, welcome. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book. If you're here, you're probably worried about your dog, possibly medication your dog's on. Specifically, this drug, Apoquel. I wanted to address a concern that one of our community members brought up. They said that after their dog had been on Apoquel for about 1.5 years, they developed a number of serious side effects. Their dog developed multiple lumps, multiple tumors, and rear leg tremors. Apoquel has really become a popular solution for relieving allergies, itchiness in our dogs. Yes, it works, sometimes really quickly, but that result can come at a price. It can be affecting the long-term health of your dog. Apoquel is the brand name. The name of the drug is actually oclacitinib. It's an immunosuppressant drug. It's called a JAK or Janus kinase inhibitor. During allergies, there's things called inflammatory cytokines that are released. And when those bind to the cell surface, the cell receptor, a whole series of cascade of events happen, causing the itching. It involves this enzyme. They block the enzyme. This doesn't happen. But this whole enzyme system, the system of inflammatory cascade, it's there for a purpose. So yes, in one way, this magic drug given once daily, it can work in up to 50% of our dogs that have atopy, environmental allergy. Yeah, can stop them from itching. But it can have some secondary side effects. It's suppressing the immune response, hence that can be a problem. Most common side effects, GI, vomiting, diarrhea, lethargy, and skin masses or lumps or bumps, tumors, which was reported by our subscriber. It's been reported to decrease white blood cell count, make cancer worse, and or induce cancer. A serious skin parasite, demodicosis, can cause pneumonia, bloody diarrhea, recurrent UTIs, skin and ear infections, histiocytomas, or other skin tumors. Then also listed in their potential list of side effects are tremors, and that's what our subscriber also experienced. But really, just how common are these side effects? I was reading an article by a dermatologist who said that side effects are very, very rare. The most concerning one they said is called bone marrow suppression. That's where the Apoquel, it's suppressing white blood cell production, suppressing red blood cell production. They say it only happens in 1% of dogs. Although interestingly, when I was looking at the package insert, Zotis doesn't mention the word bone marrow suppression. You need red blood cells to do things like carry oxygen. You need white blood cells to fight infection. You don't have enough of those, you're gonna get sick and you're gonna die. Same thing can happen to our dogs. Some of the other information that I've read, been published by other veterinarians, has suggested that once you take your dog off the Apoquel, some of these secondary side effects, if they happen, they're supposedly very rare, they're going to reverse, right? So you should see that these skin masses, they may go away on their own. You should see these tremors resolve. But as with our subscribers saying, number one, they had to have surgery to get all these lumps and bumps removed. Secondarily, their dog still has these hind limb tremors. So no, just because you take your dog off, even if they have side effects, doesn't mean they're all going to go away. But having serious atopy, serious environmental allergy, that can be just so distressing for your dog. Can you imagine you're always just living in a state of itching, scratching, recurrent ear infections, licking in your groin, repeatedly licking your paws. You can't go for a walk without stopping and licking. So I understand if I had a dog that had serious environmental allergy, I would do whatever I could to relieve him or her of the symptoms. And then it appears for a lot of dogs, like this drug has worked really well. I mean, it's become the most popular drug for allergies in our dogs. So yeah, I get that. But you need to take it all in context and understand, yeah, side effects, they are a real thing. 50% of dogs respond well, right? About 25% of dogs don't respond. So there's no guarantee having your dog on it is going to stop them from itching. Does that mean you should never consider this drug and never consider Apoquel? Honestly, if you've got this serious allergic dog, you have gone through the array of different home remedies that we've discussed in multiple different videos. I'll link to many of those videos in the description box. You tried all the other alternative stuff. Nothing else has worked. Well, obviously, it's so much better for your dog to be comfortable to be not itching than not. So I 100% get that. And if I were still in practice, I know I definitely would have prescribed Apoquel. But there's a whole host of alternative options, and what they're suggesting, even for the dogs that are on Apoquel, go on some of the additional treatments. It's not just this, which is going to be the one big answer. If your dog has environmental allergy, what are some of the alternative options? Number one, make sure they're on a good quality essential fatty acid supplement such as krill and at therapeutic levels. 500 milligrams per 50 pounds of body weight twice daily, minimum. The bioactive flavonoid quercetin, it's proven to be really helpful for many allergic dogs. Doses of 50 milligrams per 15 pounds of body weight daily. The plant sterol isolated from soy, it's got some great studies showing to be beneficial for atopy. Beta-Sitosterol, it's the most important active ingredient. It's typically found in supplements such as this. They're meant to help lower cholesterol in people. Doses of 50 milligrams per 20 pounds of body weight once or twice daily. For short-term itch relief, consider the natural corticosteroid Licorice Root Extract. A half a ml of the tincture per 20 pounds of body weight twice daily. Then a long-term supplement which has an array of benefits for our dogs and is really safe, doesn't have all these serious secondary side effects. A good quality multi-strain probiotic. A recent study showed some really good results with a good quality multi-strain probiotic formula. It showed that after proper supplementation after 4 weeks, showed a marked decrease in the level of itching. And the benefits of improved GI health and improved immune response. There are a bunch out there, but one like ours, Dr. Jones's Ultimate Probiotic Formula for Dogs and Cats, great option. But what if you had your dog on Apoquel like our subscriber had? They've been off, you've taken them off Apoquel, they still have some of these secondary side effects. i.e. our little dog who now still has rear leg tremors. The medicinal herb lion's mane, it actually been shown to be beneficial for many of the tremors that people get, and it may be helpful for some of the tremors that we're seeing in dogs. Standard doses, 100 milligrams per 10 pounds of body weight once or twice daily. Then lastly, the cannabinoids, they've been extensively studied for many of the seizure disorders that we're seeing in people. They may also be helpful for these tremors in our dogs. Two in particular to focus on, CBD and CBG. Ideally, you want to get yourself a cannabinoid blend. We have one here. You're going to base it on doses of 3 milligrams per 10 pounds of body weight twice daily. Also, don't discount some of the touch therapies, i.e. acupressure, for instance. I mean, if Tuller were to have these like rear leg tremors, I would make a point of focusing on the acupressure points. I'd be focusing on the acupressure points over top of the hip, GB29, GB30, BL60, KI3 down here. Providing some acupressure right here at the base of her tail. In all cases, what you're doing is you're putting moderate pressure over top of the skin. You're going to hold that for 30 to 60 seconds. You're going to do that twice a day. And I wanted to mention one other acupressure point that some people have found to be really effective in seizures. And it's a point located right here, just at the above your bridge of your dog's nose. Ta-da! Right here between his nostrils. Hold that for 30 to 60 seconds. But leaving you with the last question, like should you or shouldn't you be using this drug, Apoquel, in your dog? The answer, I think it depends. You need to be aware of the serious secondary side effects, really being top of mind. I want to really encourage you to have gone through and explored and tried all the different alternative options. Obviously, they don't need to be our supplements, but try some of those supplements which have a proven track record of being beneficial for atopy. If you've tried it all and you're also really cognizant of the side effects, then okay, consider it. But just be really cognizant of the side effects. And to our subscriber that wrote in and shared their concern, number one, I hope your dog is doing better. Number two, consider that lion's mane. Consider a cannabinoid blend of some type. Maybe those can potentially help your dog who's got the rear leg tremors. Thanks so much for watching this edition of Veterinary Secrets on the Apoquel update, some of the secondary side effects, some of the alternative options if your dog happens to have atopy. Click up there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.